Welcome everyone to Board Exam Essentials. This is Pre-Board Examination Nursing Practice 1, questions number 41 to 60. These are former board questions, which I could actually say that this will be of help, especially in the preparation of your board examination this time or this year or in the future. So let us proceed now to our first question. Question situation. Mrs. Joanna de la Cruz is the charge nurse of the rehabilitation unit. She is responsible for the management of the unit. Number 41. Mrs. de la Cruz observes that one of the female staff is not performing her duties very well. Which of the following strategies will she implement to assist the staff nurse? A. Allow the staff nurse to select own assignment. B. Discuss with the staff nurse her performance and ways she can improve. Letter C. Assign the staff nurse several clients with physical disabilities. Or letter D. Ask the staff nurse to work as an assistant charge nurse. In this question, let's eliminate two choices immediately. Of course, we'll eliminate the first, letter A. This is eliminated because of the word select her own assignment. Select assignment is basically being given by the charge nurse herself. And at the same time, eliminate also letter D because several clients with physical disabilities. In this case, this client was observed already not performing that much. Of course, this might actually going to contribute to higher risk of possible negligence. So we're left with two choices. It's B or D. The best answer for number 41 is letter B. The best answer is letter B. Discuss with the staff nurse her performance and ways she can improve. That's gonna be the most important thing that a charge nurse will do in order for the staff nurse to feel better and be able to perform well in the future. Letter D is also wrong. Ask the staff nurse to work as an assistant charge nurse. Remember, this is actually going to be a plain staff nurse, so therefore this staff nurse will actually be coached by the charge nurse on what things are required of her to perform, especially in the care of the patient. So the best answer here is first is to discuss with the staff nurse on the performance that she is actually doing in the hospital, and will be able to give also the possible ways in order for her to be improved, especially with regards to her performance. So the best answer for number 41 is B. Let's now have 42, same situation. The charge nurse notes that one of the male staff nurse is frequently absent, and his absence have adversely affected the quality of care given to the clients in the unit. Which of the following approaches would be best? A. Talk with the staff nurse and remind him the standards of the agency. B. Place on record the absences of the staff nurse. Letter C. Write the staff nurse's a memorandum regarding his absences. Or letter D. Inform the staff nurse that the absences will be ground for termination. Of course, by virtue of leadership and management, and also with management, it is very important for us to make sure that on the first time that the event was actually noticed, there is a need for us to make sure that there has to be verbal notice. So as much as possible, this because there's already this frequent absences of the staff nurse, so there's a need for this staff nurse to be informed that being absent is basically going to affect the quality of care given to the patient in the unit. So the first thing that we are going to eliminate is letter D and letter C. Why? Because writing a memorandum regarding his absence is already a form of written reprimand. So as what I mentioned earlier, the staff nurse must have to have a verbal notice first before written. So letter D also telling that the absences will be a ground for termination. Of course, termination is gonna be the last resort if the absences is not gonna be managed, because of course suspension is going to be the first event that will actually happen before termination. So we're left with letter A and B. So the best answer for number 42 is letter A. As what I mentioned earlier, it is very important for us to make sure that there has to be verbal notice before written notice will actually be given to the staff nurse. Letter B, place on record the absences of the staff nurse. That's already a form of written, so therefore letter B is also wrong. As what I mentioned, when you are going to reprimand a staff or employee, it is very important for you to start with verbal reprimand or verbal notice first before written notice. Let's have now question number 43. Same situation. The charge nurse presents to the administration of the agency a plan to decrease the client to nurse ration from 8:1 to 6:1. She should emphasize the effect of the proposal ratio in A. Institutional resources, B. Nursing recruitment policy, C. Standards of nursing practice, or letter D. Client care quality. Take note, if you're taking into consideration decreasing the ratio from 8:1, it means 8 patient is to 1 nurse into 6 patient is to 1 nurse. So which of the following resources are basically or which of the following effect will have uh, greater impact to? So is it institutional resources, nursing recruitment policy, standards of nursing practice, or client care quality? Take note, we're talking here about the number of number of patients to nurses care. So of course, this proposed ratio will have a greater benefit to, of course, it's not the nursing recruitment, because of course it it is gonna be not the priority this time, and also it's not about the resources, because of course the resources is not our most important priority here. So the best answer for number 43 is letter D, client quality care. Remember, when there is going to be a lesser ratio of patient towards a nurse, it means that it will actually going to improve more of the care that the nurse will be able to deliver to each assigned patient. So the best answer for number 43 is letter D, client care quality. Let's now have question number 44. The charge nurse assigns a new staff nurse to administer medication of a client undergoing rehabilitation. Which detail of the client's drug therapy is a staff nurse legally responsible to document? Letter A, client's reaction to the drug. Letter B, client's socioeconomic status. Letter C, peak concentrating time of the drug. Or letter D, safe ranges of the drug. Take note, the patient or the nurse here is going to administer a medication to a client undergoing rehabilitation. Of course, the most important thing that we need to take into consideration, especially with regards to documentation, is for us to make sure that the patient is not having any untoward reactions to the administered drug. So the best answer for number 44 is letter A, client's reaction to the drug. Letter B, client's socioeconomic status. This is not actually part of the medication rights. So of course, the reaction is very important because it's part of the rights of drug administration. Peak concentrating time of the drug, that is not our priority because that's also not part of the rights of drug administration. And safe ranges, C and D has the same thought. When we talk about concentrating time and safe ranges, it talks about the dosages of the medication. So the best answer for number 44 is letter A, client's reaction to the drug. Let's now have question 45. The charge decides what is best for the rehabilitated client and acts on the decision without consulting the client. The charge nurse is applying a moral principle, which is A, fidelity, B, autonomy, C, beneficence, or D, paternalism. Of course, when you talk about making decisions without consulting the client, that's gonna be the role of the church nurse to have his or her decision making without involving others, because of course she has occupied a certain position, and that's gonna be a form of authority. When you say fidelity, that's gonna be faithfulness, and when you say paternalism, that's gonna be applied when we talk about in the medical field, we talk about the doctor as the profession who makes the great test decision making. And of course, when you say beneficence, this is actually in relation to providing the utmost benefit of our patient. So the best answer for number 45 is because of the word without consulting the client. It means that the church nurse is practicing her independence to make decisions, because of course that is a given position to the church nurse. So the best answer is letter B, autonomy, because of course autonomy is your self-determination or your independence to make decisions on your own. Okay, so the best answer for number 45 is letter B. Let's now have 46 situation. RA 9173 was enacted into law on October 21, 2002, considering that it governs nursing practice in the Philippines. Nurses must be cognizant of its provision. Number 46. Which of the following provisions is embodied in RA 9173? Letter A. Students entering nursing must belong to the upper 40% of the graduating high school student. Letter B. The board recognizes nursing specialty organization. Letter C. A refresher course is required to those who failed for 3 times. Or letter D. The board is composed of 5 members. Of course, when you're talking about provisions embodied in RA 9173, it means that this is actually an inclusion of this specific law. Let's eliminate letter A because letter A is actually part of the previous law, which is the RA 7164, and that's gonna be our Philippine Nursing Act of 1999, and that's gonna 1990. That's actually going to that's gonna be telling us that it's gonna be requiring at least 40% of the graduating class ang maka-enroll sa nursing. Then also, eliminate natin yung letter D. The board is composed of 5 members. Of course, the board, according to RA 9173, the board is now composed of 6 members and 1 chairperson. So therefore, they are composed of 7 individuals. So let's now have letter B and C. So the best answer for number 46 is letter B. The board recognizes nursing specialty organization. Of course, we already have so many nursing specialty organizations now in the Philippines. We have the psychiatric nurses in the Philippines, the operating room nurses association of the Philippines. We have the National League of Government Nurses, so that's going to be part of the specialty organization. Letter C is also wrong because this refresher course is actually omitted in our RA 9173 because that's actually part of the previous law, which is the RA 7164, which is also going to be the Philippine Nursing Act of 1990. Okay, so the best answer for number 46 is letter B. Let's now have 47. Which of the following foreign licensed nurse may be allowed to practice nursing in the Philippines? Take note of the word foreign licensed nurse. It means that these are nurses who are actually from the outside of the country whom may wish to work in the Philippines for a period of time. Letter A, Filipinos who are educated and licensed in the foreign country. Letter B, those who were born in the Philippines but has required a Canadian citizenship. Letter C, those who are working as missionary to practice in medical mission for less than 1 month. Or letter D, those who are foreign national but married to Filipino national. Of course, when you talk about this, we have 3 things to remember. Of course, the first one is foreign nurses who are on mission. Next is foreign nurses who are actually considered to be specialists. And then, of course, the next one is foreign nurses who are actually acting as exchange professors. So in this case, when you take into consideration that one, of course, the best answer for number 47 is letter C. Those who are working as missionary to practice in medical mission for less than 1 month. Take note, this is basically temporary permit because of course they will actually going to be staying here in the Philippines for a specific period of time. Letter A, Filipinos. Of course, you are already considered a Filipino. You're not considered foreign. And then of course, Filipinos. That's the same. And this one, those who are foreign national but married to Filipino national, because it was not mentioned what kind of service this nurse will be giving here in the Philippines. So the best answer for number 47 is letter C. 48. Which of the following duties and responsibilities of a nurse considered within the scope of nursing practice? A. Apply sublingually nitroglycerin sulfate to a hypertensive patient, then refer to a physician. B. Does internal examination to determine cause of antenatal bleeding. Or letter C. Does episiotomy. Or letter D. Attends to normal deliveries. Of course, it is actually stated here, nurse considered scope of nursing practice. So it means that this is actually part of our scope of nursing practice. Letter A is eliminated because, of course, administering medication is actually a dependent intervention, so that requires a doctor's order. Letter B is also eliminated because here there's already bleeding, and of course, if there's bleeding, there's no need of a nurse to do internal examination. Okay, so which of the two remaining choices is actually actually the best answer? So the best answer is letter D. Attend to normal deliveries, because of course that's normal deliveries. Letter C, thus episiotomy. Of course, episiotomy repair is actually being allowed to be done by nurses only if there is already training that has been done, that has been satisfied by the nurse doing the procedure. So that is letter D is the best answer for number 48. 49. Which of the following does not govern the practice of nursing in the Philippines? We're looking for a wrong answer here. So, does not govern the practice of nursing in the Philippines. So, of course, I have mentioned before that if there are two choices in the answer or in the choices that has the same thought, that will be eliminated. So, eliminate letter A and letter B, because this is actually going to be a positive answer. What we're looking for is a negative answer. So we're left, remember, board resolution on standards of nursing practice is actually going to govern our practice. Board resolution of code of ethics for nurses is also going to govern our practice. So we're left with two choices. It's letter C and letter D, RA 7164 or RA 9173. Of course, our existing law in the Philippines today is going to be RA 9173. So therefore eliminate this one because this is positive. This is negative. So the best answer for number 49 is letter C, RA 7164, which is actually going to be our previous law, which is the Philippine Nursing Act of 1991. Let's now have our question number 50. Under the current law, there are 7 members of the Board of Nursing. The membership of the board shall represent which of the following? Of course, we have to remember 3 areas of representation of the board. Is it nursing education, nursing service, community health nursing, or mother and child nursing? Of course, when you talk about nursing education, it's very important because, of course, this is actually going to be the most important thing that that will be represented by the Board of Nursing. So, correct po yung number 1. So, eliminate letter A and letter B. Number 2 is also correct, nursing service. So, therefore, the best answer for number 50 is letter D. That is going to represent the 1, 2, and 3, nursing education, nursing service, and community health nursing, except the mother and child nursing, because this is also considered to be specialized field of nursing. So, the board will represent this area. So, dapat merong isa dyan na dean, merong isa dyan na chief nurse, at saka meron din isa dyan na public health nurse. Okay, so the best answer is letter D. Let's now have question number 51. Situation. Piling is 2 months pregnant. Her parents did not know this. Piling informed her friend Miling about the problem. Miling referred Piling to Waning, an abortionist. Piling had an abortion. Number 51. If those involved will be charged legally, who is the principal? Of course, we have to remember 3 individuals involved in a crime: the principal, the accomplice, and the accessory. When you see the principal, he is actually the main man of creating a crime. And of course, when you say accomplice, that's going to be present before committing a crime. And when you say accessory, that is actually present after committing the crime. So in this case, who is actually legally charged legally as the principal? Is it Piling? Piling is actually going to be the one who is actually pregnant, and then Waning is actually the abortionist, and Miling is actually the friend. So the principal individual who is actually committing a crime here is basically Waning, because Waning is the abortionist. So therefore, letter B is the best answer for number 51. Let's now have 52. Who is considered as an accomplice? As what I mentioned earlier, accomplice is present before committing an act. So again, Piling is the one who has the abortion, Waning is the abortionist, and of course Miling is a friend. So in this case, an accomplice who is actually present before committing a crime is Miling, because Miling has referred patient Piling to Waning, which is actually the abortionist. So the answer for number 52 is Miling, because Miling is an accomplice. She's actually present before committing the crime. Let's now have 53. If during the investigation the pieces were not found because Carling, the maid of Waning, burned it, Carling is considered as A, accomplice, B, accessory, C, principal, or D, co-principal. Of course, we'll have to eliminate immediately letter D because there's no such thing as co-principal. So in this case, of course, Carling is considered to be parang having a participation of the abortion because she actually burned the evidence of the crime. So in that case, as what I mentioned, if that is committed after the crime is committed, and that's going to be part of being an accessory. So the best answer for number 53 is letter B, accessory. Just remember, if that's going to be principal, it means that you are the direct involved individual who committed the crime. When you say accomplice, it means that you're present before the crime is being committed. And when you say accessory, you're actually committing an accessory of an act, especially if you're present after after committing the crime, after the principal has committed the crime. So the best answer for number 53 is B. 54. A nurse is liable as an accomplice in an abortion if she A. assists in the escape of the offender, B. refers the pregnant mother to the abortionist, C. conceals the evidence of the crime, or D. none of this. So of course, if the nurse is actually considered to be an accomplice of the abortion, then the nurse is actually present before the commission of the crime. So letter D is immediately eliminated. Letter C is also eliminated, and also with letter A, because letter A is gonna be part of the accessory. And then of course letter C also is part of the accessory. So the best answer for number 54 is letter B. Let's now have question 55. Which manifestation is not present in missed abortion? Take note, we're looking for a wrong answer. Not present in missed abortion. Of course, if there's missed abortion, present po yung pain. That's positive. We're looking for a negative answer. There's bleeding. And of course, there's cervical opening. So that is all of this. All of this are not present in missed abortion. So in that case, it means that this is actually not present because that's a missed abortion. There is no successful abortion. So the answer is letter D. Let's now have another situation. One of the best ways to prevent psychiatric disorders is the development of skills in handling crisis intervention. 56. Who would be a good candidate for crisis intervention? Take note of the word good candidate for crisis intervention. A. A client with a previous melancholia. B. A client with a fixed coping mechanism. Letter C. A client without support system or significant others. Or letter D. A client with a known precipitating factors. This is actually going to be the umbrella effect of a question, because of course we're looking for a general answer here. So letter A is actually specific, letter B specific, letter C is specific, so answer is letter D. So the best answer for number 56 is letter D, because known precipitating factors. When we say precipitating factors, it means that it can be melancholia, it can be a problem of coping mechanism, and of course lack of support system. So letter A, B, and C are gonna be part of letter D. That's part of the umbrella effect method of choosing the right answer. Let's now have 57. Which of the following is not an accurate assumption about crisis intervention? Not an accurate assumption. We're looking for a negative answer. A therapist assumes a passive indirect role. B. Little importance is attached to a past emotional understanding. C. It's an expensive short-time therapeutic approach. Letter D. It is important to have the client achieve an intellectual understanding of the immediate case or crisis. Take note of this not accurate assumption about crisis intervention. So it means that this is actually gonna be not true. Letter A therapist assumes a passive. Remember, we have to make sure that we are going to implement an active and direct role, especially in crisis intervention, because we want to make sure that this patient returns or resumes to pre-crisis state. So the best answer for number 57 is letter A. Letter B, little importance is attached to past emotional understanding. Of course, our focus is the present. So that's going to be the present. Letter B, letter C, it is an expensive short-time therapeutic approach. Of course, it's actually going to be shortened because this is going to be expected to be addressed in 2 weeks' time. And it is important to have the client achieve intellectual understanding. First, there's a need for the patient to understand the immediate needs of the crisis intervention. So the best answer for number 57 is letter A. It has to be active and direct role. Let's now have 58. In doing crisis assessment, which of the following is least important? Take into consideration the crisis assessment and least important. So is it successful past coping mechanism? B. Assessment of long-term need. C. Identification of precipitating events. Or letter D. Urgent availability of resources. Of course, it is very important for us to make sure that we know the identification of precipitating events. That's gonna be the focus of our assessment then. And also with successful coping mechanism. Of course, this is positive. This is also positive. Take note of least that's gonna be negative. So best answer for number 58 is letter D, urgent availability of resources. Of course, it doesn't necessarily need resources because of course we have to use our therapeutic use of the self and therapeutic communications, and that's going to be very important in order to manage the crisis that the patient is actually experiencing. So the best answer for number 57 is letter D, urgent availability of resources. Let's now have 59. A patient with heart problem was admitted in the ward. The nurse learned that the patient has been widowed for a month. The patient often talks about her husband with practically all the staff nurses in the ward. Which of the following is the appropriate focus of crisis intervention approach for this patient? A. Revolving her dependency needs, reevaluating her marriage, teaching her to live as productively as possible, or supporting a grief reaction. Take note, widowed for a month. It means that's gonna be parang recent event of the patient. And of course, letter A is wrong because of the word dependency. It means that we are not going to focus on the dependency of the patient. And remember, there's no marriage at all because the patient is already being widowed. So the best answer for number 59 is letter D, supporting grief reaction. Of course, that's part of DABDA, denial, anger, bargaining, depression, and acceptance. Of course, it is very important for us to make sure that there has to be support of grief with the patient. Let's now have the last question. In counseling patient in crisis, the nurse applies the client-centered therapy of Carl Rogers, who interprets clients' experiences by using which of the following groups of terms. Of course, it talks about crisis, and of course, Carl Rogers experiences, clients' experiences by using which of the following groups of term? A. Behavior and feelings. B. Self-awareness and self-actualization. C. Scripts and counter-scripts. Or letter D. Group interaction and responsibility. Of course, when you say clients' experiences by using which of the following terms, it means experience, and that's going to be focusing more on feelings, and that feelings is going to be the basis of certain behavior. So the best answer for number 60 is letter A. Self-awareness is part of Johari's window, and scripts and counter-scripts is part of the therapeutic communication, and group interaction and responsibility, that's part of your group therapy. So the best answer here when we talk about the experiences of the client is basically talking about the feelings that is also going to be part of the behavior of the patient. Okay, so that is it. We're done with the 20 questions for this set. That's going to be board exam essentials, pre-board examination, nursing practice 1, questions 46 or 41 to 60 of the former board questions. I hope you got all the answers correct. This has been Nurse Jose at your service to make your best even better. To God be the glory.